So in this podcast, we're doing a special podcast. I'm gonna do a couple of these. Let me know what you guys think. But I was excited to interview Kobie Benham, who is a nurse practitioner who's the owner of Snyder Healthcare, but also Sweetwater Healthcare as well. Now, this is a great conversation. We did a deep dive in everything when it comes to healthcare, what it's like as a nurse practitioner, what it's like to be an owner, how is rural health different than maybe healthcare in other places. We talked about hormone therapy. We talked about some optimization of health, treating the whole body, and getting down to the root cause of what is going on. So I like doing these deep dives. I thought it was a little bit different than what I normally do. Let me know in our newsletter and our comments what you guys think. As always, if you like what you hear, if you like what you see, subscribe to our channels. And I have on the show notes on how you can get in contact with Kobie to visit him. He's a great resource, and I really enjoyed this conversation that we had with him. Kobie, your journey you're very interesting about how you started to how you developed your practice. So why don't you just tell us a little bit about how you got started, why you decided to go into develop your own practice in two locations of all places?
Yeah, for sure. So I kind of grew up, I think I'm the first male on either side of my family to actually go to college and finish. So I don't think I like grew up thinking like, oh, I want to be I want to own a clinic or something like that. Honestly, I thought I was going to be maybe an engineer. I thought I would go to college, but I thought I was going to be an engineer. We grew up on a farm. We just fixed stuff when it was broke. So I was always interested in how things worked.
Yeah.
And at some point that transitioned to how the body works and how people work. And I got my CNA when I was like 15, my nursing assistant license, and fell in love with people, and then just never really stopped after that. And I liked that a lot more than, all the letters they kept putting in the math equation. So I kind of swapped gears pretty early on and went healthcare. As far as like when decided to go private, I'm not really sure. I grew up in a small West Texas town, and I feel like we're blessed to live here, but we're needing in the healthcare department.
Yeah.
There's a shortage of doctors across America, but man, West Texas and rural areas we're hurting for us. So being a nurse practitioner, there's some limitations there on what I can do. But I think that was I saw a need, and I thought maybe there was a way that we could fill that role.
So what have been some of the challenges of kind of going into a smaller community? Because, obviously Sweetwater and Snyder, it's not like some of the bigger communities around the area, Lubbock, El Paso, things like that. So what are some of the challenges that you've had to deal with? And how has the healthcare been a little bit different maybe in those areas than maybe in some of the bigger cities?
Yeah. Well, I grew up in Rotan, and we had like 1,500 people. So I always thought Snyder and Sweetwater were big. So I don't know what you're talking about. But you guys had Walmart, man. We just, yeah, no, nothing against Thriftway, the little grocery store there. But no, honestly, I really have always felt called to the smaller towns. I felt like if we were to focus on Sweetwater or Snyder, maybe we wouldn't hurt the small population of, the hospital and things like that.
Yeah.
We could be a resource rather than a competition for the local hospital. So one thing that I definitely think has been challenging for us being in small town is I feel like a lot of these farmers or even just people that live in rural health, we're stubborn. We're still out here, and their families have been here for hundreds of years, but man, we're stubborn people. And so a lot of times I feel like once you get people into healthcare, sometimes you're catching that disease process later than maybe somebody that has a little bit more education. And I don't know if that's like a knowledge deficit or a lack of access to healthcare. So, we have less specialists. So we end up, I feel like we do quite a bit in-house to kind of take care of people. But yeah, definitely one thing is the lack of healthcare has made it to where we get some interesting stuff and some amazing people, but some interesting people.
So, okay, so I'm curious. So, obviously, in some of the bigger cities like Lubbock or some of the other cities, we may have a little bit more access to specialists, to other procedures, other, imaging. Rural health is a very different animal. And you're exactly right. West Texas is such a wide variety, a wide space, but it's hard to find healthcare that's there. So, how do you feel like that you've been able to manage just that breadth, but also that complexity that you may see that maybe PCPs in a place like Lubbock may not see? How do you handle that?
I think a lot of that, it's been great to have relationships with, unfortunately, a lot of the specialists end up being Lubbock or Abilene. And because of my background at UMC, I was able to create some really good relationships there. So that's been huge, being able to, you guys are amazing. You can get people in a couple of days, but sometimes, dermatology or, Dr. Perez is really fast in his group in cardiology. There's some amazing resources out there, but it still may be a little bit of time before we can get in. And so I think having access to those people and the vast knowledge that they have has been insanely beneficial to us and to patients, because there's times where people are not going to go to the ER. They're not
Yeah.
going to go, and that may be what's best because they could get answers so much faster. It takes me 24 hours to get a lab result,
Yeah.
and so even with the best education and really those ER precautions, sometimes people just don't do it. So I think the
Yeah.
relationships has probably been one of the most important things being out here is, hey, you got to help me out, man. I got to get this guy in. Something's going on. And I've done that to you before too, where I'm like, hey, I need a favor. I'm so sorry. So I think those relationships have been really important to kind of keep patients uh, cared for really well,
Yeah.
despite the proximity issues.
Yeah.
Uh, I feel like in primary care, you kind of have to be a jack of all trades anyway. So it's almost
Mhm.
like growing up on a farm. You may not have the perfect solution, but you better figure out how to like get you pretty close and get you to somebody smarter. We can fix a car and get to town kind of thing. And so sometimes it is that, and I have to be honest with patients, and I'm like, look, I'm not a cardiologist, I'm not a gastroenterologist, I'm not a dermatologist, podiatrist, ortho, uh, but we can buy a little bit of time until we can get you into
Yeah.
the right hands. And so I think just being honest with people and having good relationships has been just amazing.
Yeah. And so you do primary care, and so some of our audience may not realize what exactly primary care is. So if you don't mind just explaining what exactly does a PCP or a primary care physician or provider, what do
Yeah.
they do? What's their job?
Oh man, I feel like we're the catch-all. We have the
Yeah.
greatest job in the world. It's never boring. We do something different every single day. So I think primary care may be as simple as doing like your annual wellness or your school physicals, or we do DOT physicals. We do a lot of things there, but a lot of times, especially in rural health, we are people's access to diabetic care, to hypertensive care, to all of your screening and preventative care. And I really think prevention and holistic care is where healthcare is going. And so I think that we make a really solid, kind of first step sometimes, but also maybe the only step. I have some really well controlled diabetics who were not very controlled whenever I met them, and I have some really great control of blood pressures, and they have never been before. And so, we may be the only healthcare that people have, or we may just be the stepping stone to get somebody to a specialist. But a lot of times, primary care is your friendly neighborhood, access to healthcare in whatever capacity is needed. And we
Yeah.
do some other things. We do hormones and we do weight loss and we do aesthetics and some, Botox and filler and things like that. But I feel like the bread and butter, the reason that we get up in the mornings is to take care of patients and their families, all stages of life. I joke and say womb to tomb, but we're not doing a lot of pregnancy. I'm sorry. We'll get you into the right hands.
That can be a little bit of a different animal, that's for
Yeah,
sure.
yeah, absolutely. Those guys that do that on purpose, man, they're wild.
That's true. Now you mentioned whole body care. So, you guys have a very unique approach to that in terms of taking care of patients and that whole body care, but especially in your practice. I know that's kind of something you've talked to me about. Maybe explain to my audience, like, what do you mean by that? What exactly do you mean
Yeah.
by kind of whole body care, the optimization of hormones, kind of how does that play a role in your practice?
Well, I think it's hard because if we were in a big city, I think we could have our own little niche, or and we could be like the hormone people, or maybe the aesthetic people, or even the primary care people. Um, Due to the lack of access to healthcare, I kind of feel like we need to be pretty solid in all those areas. And so for us, we really want to focus on the whole person rather than just being like, oh, that's Joe Blow, that's my diabetic. That's not him. I want
Yeah.
to know. I want to know that's so and so. This is his family history. A lot of times I know people's dog names and what's going on with their kids, and so like holism to me is there's a depth of knowledge
Yeah.
about the patient and about them as a individual, what's important to them. And I think that should guide healthcare, especially in primary practice. Like I can't have a one size fits all approach, and we can't, especially in
Yeah.
West Texas, because it's not real. It's fake,
Yeah.
and we don't want to be that way. And so for me, holism is treating the whole body, yes. And rather than talking about diabetes, let's talk about how obesity plays a role in and how that starts the whole compromise. Metabolic syndrome, that's the word my brain was trying to find,
Yeah.
sorry. How obesity rolls into metabolic syndrome and insulin resistance, and this is a process over time. It didn't happen overnight. We're not going to fix it overnight, But we do need to talk about the vascular implications. Like, hey, you may have came in with erectile dysfunction, but you probably have that because you've been a diabetic that didn't know it for 10 years, and
Yeah.
yeah, of course you have fatigue. You are not sleeping, you're snoring, and your wife says that she sleeps two doors down. So I think like holism for me is, yeah, people come in with a concern or I call it an R code, right? If you know CPT coding or
Yeah.
ICD coding rather, those R codes, those symptomatic concerns. But what's the actual cause, and how do we treat that person deeper than like, here's here's some medicine for depression. What if the
Yeah.
depression is caused by a deficiency somewhere else, or something like that?
So let's say, for example, let's just do a hypothetical. Let's say I'm coming into your clinic, and I have issues that I'm tired, I'm gaining weight, I don't know what to do. So just kind of walk through like what would your approach be for that patient in particular? Because I have found for you in particular, the way your mind thinks about people and patients and your approach to healthcare is very different than I think from most other primary care providers. So I think my audience would be very interested in just hearing, I'm coming in if I'm tired, I'm overweight, I've done everything. I'm coming to Kobie. I've heard he can help me out. How would you kind of approach that patient?
Well, I think it kind of depends. It depends on you as a person. How old are you? What's going on? How long have you felt this way? What other things are going on? What meds are you on, right? I talk a lot about like nutrient vitamin deficiency,
Mhm.
right? If you talk about common medications, like okay, you're gastro, so your PPIs, your H2 inhibitors, they are always going to affect, in some
Mhm.
extent, I'm going to be cautious on how I word that, but they're going to affect absorption of certain
Yeah.
nutrients like your B12, your folic acid, your iron. Um, Vitamin D, ACE inhibitors, like people that are on lisinopril, or any of those prill medications, they play a role in absorption of certain nutrients. I think the big one with them is zinc, so there's a
Yeah.
lot of things that could be going on there. The problem with that is I can tell you that, but I can also tell you that if you're one of my normal patients that has Blue Cross Blue Shield, we can't go in and spend $1,000 on labs. Most of us can't afford that, especially not in
Yeah.
rural Texas.
Yeah.
And so a lot of times it's kind of hard. You have to work with that person. And you have to be honest. Hey, look, I think you might have a hormone deficiency or sleep apnea, or maybe you're pre-diabetic or diabetic, and this is an insulin problem. And you have to create that relationship right off the bat, because I do have some patients that if it is a hormone problem and they want to talk about bioidentical hormones, which I believe are safer,
Mhm.
um, we have to talk about what that might cost. And so
Yeah.
I don't want to test you for a bunch of stuff that insurance may not pay for, or lead you down a road for something that insurance may not pay for if that's not even an option for you financially. So I think that's the holism for me includes finances. You have to
Yeah.
talk to people and like, what does that look like for you? If we go down this route, could you afford $300 every few months? With weight loss, especially, everybody wants to lose weight. Everybody wants a magic pill. I wish there was, or people want to talk about GLPs, and they're
Mhm.
great. They're a great tool, but I just think we have to be honest with people up front. Like, hey, what does finances look like? I don't know your
Yeah.
house. I don't know what's going on. What does that look like? What is the quality of life potential benefit worth to you? How much of it can you pay for if insurance doesn't? And we've worked out some good deals with our vendors where we can, offer a lot better prices than most people for labs to do some deeper dives. But you have to be honest with people, because if you're testing for something and you find a deficiency, it's harder for me to find out later and be like, oh well,
Yeah.
you can't afford it. I'm sorry. That's not cool. So I like being upfront with people and saying, this is what this could cost if it's this. This is why I want to test for that. Does that make sense for you? Is that something you believe in? Is it something you want to learn about? Because if it doesn't, we're wasting people's time and their money,
Yeah.
and that's a precious resource.
Yeah. I think you bring up a very good point, which I think a lot of us just in healthcare, I'll be honest, even myself, I don't always understand the costs of what we're doing for our patients. And I can imagine just being in rural health, that cost factor is probably even more pronounced with, people who may not have, you know,
Yeah.
good incomes, or they may have fixed incomes. And so how is that? Can I maybe talk a little bit more about your approach to that? How is specifically rural health in terms of finances, people's livelihood, how does that play a role in how you're able to manage those patients, to the best of your capabilities?
I think we have to be, especially in rural health, you have to be a forever student. So the first thing
Yeah.
I did actually before opening my first clinic was I took a billing. I'm a certified professional biller.
Oh, wow.
I've never billed a chart, by the way. I code my own charts, but I've always paid a billing company. But I
Yeah.
wanted to have a better understanding of how do we two parts. Selfishly, I needed to figure out how to convert the time that we spent. Nobody teaches us that in school. How do we convert what we do in the room to create value as to an organization or to myself or whatever that looks like, so that I can teach that? But also, is there? It's a game, right? Like the people that are creating the codes and the billing are usually not medical. That I'm trying to be really cautious in how I word this, but
Yeah, I know.
they don't think medical. So I wanted to learn how they thought. And so that helped me a lot, from a billing perspective, to say, oh, okay, well, if I bill it this way, a good example is if I drop obesity as the first code in my chart and I drop a 99214, that moderate complexity office visit, it will not get paid. It doesn't matter what insurance you have. I will not get paid. And if you have a high deductible plan, that bill is going to jump to the patient sometimes, or there's an opportunity for that. So either way, we both lose. The insurance does fine, but the patient and the provider and the team suffer. So for me, it was really important to learn, how does this work, as far as why does a patient get a bill, and what can I do about that? Because unfortunately, it's not legal for me to write off somebody's balance on their insurance, or say like, oh, don't pay me your co-insurance amount. I can't legally do that. So I wanted to figure out kind of how the game was played, and how to use that to, complete, like I said, selfishly, we got to figure out how to keep the doors open. You have what, 30 plus employees. I want to get there
we
someday.
all have bills to pay, unfortunately.
Yeah. And so, but also, I don't want to cause harm to my patient by affecting them financially. That's still harm, in my opinion. So that was probably the first thing that I did, was figure out what happens after you see them. How does that convert to, what does insurance do with that information? And then I started working against, like, okay, for example, I talk about high deductible plans a lot, but a lot of my commercial patients, especially if they work for a small company like mine, they might have a really high deductible. They may have Blue Cross and everybody thinks that's great, but they may have a $5,000 deductible. And so I worked with a lot of our vendors, like, okay, what if we bill this lab, a different way? If they pay cash for it and we bill it through the side of our insurance or our company that we do Botox and stuff through, what would that cost the patient that way? And it's ridiculous that Blue Cross can, I'm gonna be cautious again, but these, not Blue Cross, sorry, Blue Cross, you're not the only ones. The insurance can negotiate these ridiculous rates, and if you have a high deductible, it just falls on the patient, but they're going to negotiate the rates down. So for me, it was just a matter of, how do we work with the billing, or with insurance and with patients, and provide the best care? And I think there's ways to do that. It's just always been the question of, how do you do that correctly? I don't know. I'm learning. I'm a forever student, Dr. Islam.
No, listen, I think that's admirable, because, being that lifelong learner, I mean, it's what you got to do. Medicine's always changing. The rules are always changing where we're at. And doing the best thing for your patient, it involves lifelong learning. You are 100% right, Kobie. I admire you for, taking a billing course. I think it's awesome. I wish more people in healthcare did that, so we actually knew what we were talking about. But also, you're an advocate for the patient. You know what I mean? That's incredible that you're doing that.
It's been fun. I wish I could say I'd gotten it right all the time. My poor patients have been kind of guinea pigs on the wrong way to do it. But because of that, as long as you don't do it twice, you might be forgiven. So that's kind of been the thing. Lifelong learning. Figure out a way to learn from your mistakes, and be very quick to apologize when you're wrong. Because I've been wrong a lot. I think we do a good job, but I don't think we do a perfect job. And that's what, eventually we'll figure out how to be better.
Obviously, no, you're right. So, Kobie, I'm really curious. So, you did something that I think is incredibly crazy. You opened up 2 clinics, and you're just one person. So, explain to me, or explain to my audience, why did you do that, and how has it been to try to run 2 practices that are in completely different locations?
Oh man. Well, I don't want to take credit for anything. I had some amazing mentors. I shout out to Lacey and Keith Meeks, man. They've been
Oh, they're
just a
great.
godsend. In fact, I tried to partner with them. They were too busy for me, but they've been amazing mentors ever since. So I don't think I would be where I was at, or anywhere close to here, without them. My wife is an accountant and a stay-at-home mom, and so she's homeschooling babies, and she's helping with the money side of the business. So I would have drove us broke a long time ago. Um,
I think both our wives are the ones that pretty much run everything. I feel the same way as well.
yeah, yeah. So I don't. I feel like whenever it comes to, and then, man, God has been just.
Mhm.
If you look through it, I'm not that good. I'm not that smart. I'm not that. I mean, I'm gifted. I don't want to take that away from him, but it's been a God thing, man. We've been really, really blessed. So I
Mhm.
don't want to take anything away from any of those people. and my team has been really gracious. I joked with that the patients, have been guinea pigs. My poor team has been guinea pigs. I have people with me that have started like our second day working here and have been through some chaos. So we have a great team, and we're continually learning, and changing. And they're pretty good at stepping up and saying like, "Hey, Kobie, this is dumb. There's a better way to do this," and helping me kind of guide towards it. So I don't know what got into me. I think there's probably a DSM-5 criteria for insanity or something that you could probably find for me. But I always loved small town West Texas, and I grew up in Rotan. And so if you were actually to map both of my clinics from my house in the middle of nowhere next to the cows, almost the same distance. So yeah, that was kind of my deal. Is I wanted a town big enough to support the rural health clinic that was already there,
Yeah.
as well as our private practice. I
Yeah.
didn't want to start in a really small town and hurt somebody's job or hurt
Yeah.
something as man. The hospital and the specialist that they have in both locations is very important to the community. It's one of the
Yeah.
biggest employers. So I felt like both of those towns could support both, especially with the surrounding communities, and we could be an asset rather than something that would hurt the community. Whereas if we'd open in Rotan, there's 1,611 people because I pass it every day going home. Man, that would hurt the health clinic if I were to open there. If
Yeah.
if we were to take any volume from there, it would affect the community and a resource that's really important to the community. So for me, I felt like both locations, 10,000 population seemed to fit our why and could support us, if that makes sense. We could be an asset rather than a hindrance for the community.
So explain to me your why. What do you mean by that? What did you mean by that comment?
So if you were to, that's hard. I think our why, our mission statement is kind of long, but the gist of it is everyone deserves to be treated like family.
Yeah.
And if you go to primary care, I'm not even talking rural health, it's not uncommon to be in a waiting room for a crazy amount of time.
Yes.
And
Oh my gosh.
you'll
I've experienced it. My patients have. Yes, I understand completely.
Yeah, and I always think about like I love my grandma to death. She's the reason I have work ethic. But I imagine like my grandma sitting in that waiting room in those uncomfortable chairs for an hour.
Yeah.
Uh, that's not how I want my family treated. So
Yeah.
we try to take that approach to all aspects of healthcare, like
Yeah.
because everyone deserves to be treated like family. So why is our goal 15 minutes from door you walk in to seeing a provider? Why is that our goal? Because everyone deserves to be treated like family. Why
Yeah.
do we call you back 2 days after you're sick? Because everyone deserves to be treated like family. It's not,
Yeah.
if it fits that why, then it's what we want to do. That does not always the most business savvy thing that I've done. It's not the cheapest way to do business, but I can sleep at night, and I feel like if we are looking through that lens, we're providing something that patients want and they need, and an experience. We want to put the experience back in healthcare.
So you mentioned your grandma, and so I'm really curious as to, it's hard for a practice and hard for maybe providers to figure out what their why is. Like why do they like what truly is the reason why they opened up a clinic and developed a practice? So you mentioned your grandma a little bit. Explain to me kind of how you came to that process of why, because I'm sure it wasn't just overnight. Like I want to do this. So
Yeah.
maybe explain to my audience, like, how did you come up with your why? Like, what was that process like?
I think initially when we first opened, if you read, there's a handful of books, whether it's EOS or E-Myth or whatever, right? A lot of
Mhm.
people, whenever they create a business, it's a reaction to being good at a job, right? And so
Yeah.
to be completely honest, I think I created the first clinic out of I think I'm a pretty good nurse practitioner, and maybe I could do better than somebody else that I've worked for, or something like that, right? Like
Mhm.
there's a need. I feel like we could be successful here. I can do the job.
Mhm.
And so I think initially when we opened, maybe there was some degree of I'm good at this job, and so that makes me proficient to be an owner. I think I really quickly understood that that made me good to be an employee, not necessarily an owner. I shouldn't be in charge of other people's families' income and things like that with that mentality.
Yeah.
And there wasn't enough, right? Like if you were chasing a why, like a dollar amount, or like it's not worth it. This is
Yeah.
hard. Being a business owner is really difficult. And
Yeah.
and honestly, I still make less money than I did working for the hospital, and
Yeah.
and I'm 3 years into it. but I love it. And I don't know what I would be doing if it wasn't this. So for me, initially the why was I'm good at a job and I like kind of, I think I could change some things and make it better. But it pretty quickly became evident that that wasn't enough. And I
Yeah.
had to do something different. And it had to be more than that, right?
Yeah.
Especially if you're going to motivate people to be, one of our core values is unreasonable hospitality, right?
Yeah.
So we want to be unreasonable in the way that we treat people. And some of the cool things that my teams come up with through that is like, man, we have her name is Bailey. She's amazing, man. Like for birthdays and stuff, she handwrites birthday cards and they're crazy artistic and they're amazing.
Mm.
And that's unreasonable hospitality. We could just ignore people's birthdays. We don't make any money off birthdays, but getting a letter in the mail before your birthday does something for people, and those are our people. And if we're treating them like family,
So,
that's
so she writes it to patients?
yeah,
Oh,
100%. Which is
wow.
amazing. And
That is
and
amazing.
and the idea came from
Yeah.
when y'all have downtime. My comment was when y'all have downtime, not even like standardized. When y'all have downtime, why don't y'all search people's birthdays and see whose birthday it is and just call them, right? Like, because we
Yeah.
have a database of a few thousand people now.
Yeah.
That's how it started, and there was no consistency to it. And she just took it and owned it, man. We have one of our core values is ownership mentality. So
Yeah.
I think once I started putting into paper, like, what would it look like if I were to if you could see the perfect business, right? If there was
Yeah.
a reason to get out of bed every morning and it had nothing to do with money or, well, why would I do it? And so
Yeah.
I don't know. I want something that outlives me. I think that helped me kind of come up with the why. I want it to be bigger than me. I want it to
Yeah.
impact more than me. Um, but yeah, I think that was what was missing. And one of the things missing in healthcare is personalized
Yeah.
experience. I
I
feel
completely agree with you on that, Cody. That is that is so great because you're right. I think you're right. Healthcare has become so institutionalized, I feel like, you have
it's become a business, and
it
it has.
is.
It has
Yes.
to be because everything is going up. The cost of life is going up, and our
Yeah.
reimbursement is going down. And so they've forced our hand on it.
Yeah.
I think that it's broken. It really
Mhm.
is. And so yeah, no, if you're trying to run a business for money alone, this is not the way to do it. But
Yeah.
if it's more than that, then I think that we're closer to we're getting close. I'm not
Yeah.
going to say we're anywhere near perfect, but I can sleep with it. I think we're in the right direction. We're always improving processes to make it better, but yeah, I feel like the system's broken. It's so monetized that every patient encounter, unless you can be in and out of that room in 2 minutes, there's no way to make a profit, especially not in primary care. Maybe I'm not talking about you, but maybe as a specialist, maybe there's room for margins. But if the negotiated rate for an office visit is $115, I'm a nurse practitioner. I'm only going to get 85% of whatever our
Yeah.
negotiated rate is. And you know as well as I do, when they actually pay, they never pay that. Look at your EOB next time you go to the doctor.
Yeah.
Oh yeah, we billed 140, insurance paid $62. You owe 40. There's just you're getting margins, and every year, it's worse, unfortunately. So,
Yeah.
and as the cost of living goes up, we have to pay people more to be
Yeah.
here and to keep these wonderful people that we have. I I don't have government grants. You don't have
Yeah.
government grants. The hospital is not, nobody is reimbursing our losses like it would
Yeah.
if you were in a critical access hospital or even a private or public hospital or something like
Yeah.
that. So there's some really weird things that happen, but if you focus on the people and you focus on the outcomes for your team as people and your population, I think it's the answer is somewhere over there for figuring out why it's important.
No, I agree. Now you mentioned your core values. I'm really curious. So what are the core values for your clinic or for your practice?
Yeah, I'm gonna cheat, and this is really sad. I'm gonna cheat and get them out because I'm proud of them, but I also don't want to. But I do have them pulled up on my desktop, so I'm gonna
Yeah.
I'm gonna cheat. So yeah, our total mission statement, I told you the gist of it is, because everyone deserves to be treated like family. It's to serve our communities by compassionately providing medical care with a holistic touch, because
Mm.
everyone deserves to be treated like family. So, um, at first, I wanted everybody to memorize these, and then I realized like there's parts of it that would be a little bit hard because I got long-winded on them. Our vision statement is more geared towards leading Texas towards a healthy tomorrow, and so uh, yeah, something that nobody knows yet is we're actually rebranding. Right now, we're Snyder Family Healthcare and Sweetwater Family Clinic, and we're trying to go through a rebrand over the next few months to TX Care, just
Mhm.
TX. care. The reason we want to do that is to be able to have one set of values, one experience that you might have, no matter how many locations may end up, God willing, pop up, or if you just ends up being Snyder and Sweetwater. We want the same experience. We want the same platform both ways.
Yeah.
And so, yeah, our vision is to lead Texas, whatever that population, that community looks like, towards a healthier tomorrow. So, sorry, marketing team, this is the first time people get to hear it.
No, it's
Um,
incredible. It's incredible. Continue, Kobie. My audience is dying to hear this. I'm positive.
Yeah, so core values. So our first one is working for God. Like I said, God's a big reason that we're anywhere close to where we're at now. So
Mm.
we want to treat everybody like family, but kind of going back towards the golden rule. We want to treat others like if we're working for God. I think that puts it into good easy way to think about it. Would you do that if Christ was watching, or whatever,
Yeah.
however you want to interpret that? The second one is write thank you notes. We pass positives up, and we pass them all around. So we pass positives all around, we pass negatives up. And that's kind of like a no gossip policy, if you will. I
Yeah.
think that one thing that we've learned over the last few years is negativity breeds negativity, and it's cancer. And so if we can just be positive, that may be writing thank you notes or those birthday notes. Like I said, Bailey's amazing at, we want to be positive. And that doesn't mean that we're not going to have bad days and you're not going to have to address negative things, but gossip's different than addressing something that's wrong. Unreasonable hospitality. We're kind of weird. We're going to break down traditional barriers to try to improve healthcare and change the market, even if it looks weird, even if it's different, even if it's not normal. The next one is sweep the floors, and that's kind of that ownership mentality. My staff and my team has seen me mop floors, sweep floors, go pick up trash in the parking lot, and because of that, I think that modeled behavior, you'll see it. They're over here picking up trash after 5 o'clock. Like, that's an
Yeah.
ownership mentality that I don't think you can pay for.
Yeah.
Freaky fast. We stole it from Jimmy John's. Be quick, but don't hurry. And I think
Yeah.
that's kind of funny. And I think there's an art to that. We want to be fast. We don't want people to feel hurried, but that means, that 15-minute goal from door to provider and it's funny, like, my staff now will write slow on the back of my paper when you walk in the door. In other words, like, slow down with this one, or this patient needs
Mm.
time, or um, a lot of times with new patients, we'll do like at GAD, like that anxiety screen.
Yeah.
And so a lot of times they will circle it in like red or something because I'm ADD, and I'll skip over it, and they'll circle like GAD to make me look at it. Like, they are really intentional about be quick, but even helping me to say, like, hey, this patient needs more time. So be fast, don't hurry. Um, and then the last one's 2 ears, one mouth. So I think God gave us 2 ears for a reason. We want to actively listen to people without judgment, before we speak.
Those are
So
incredible. I mean, those are amazing values. How do you come up with that? Like, how did
uh,
you think about that? How did you come up with that? That's fascinating. Because that
so I
you read core values all the time. I see them on restaurants and businesses. Like, ah, come on, this is corporate speak. But this is like you, and
yeah.
it's to the point. It gets the point across, but it's so you. So how did you come up with that?
Oh, thanks, man. I had the team helped with it, so I don't know how many poor renditions they saw of different things, and so I think, kind of going back to our motivation, almost, like, I tried to attach something biblical or ethical or moral to what we did. And also, like, if we were to hire and fire by these, you always hear people say that, right? Like, we hire and fire by our core values. I've heard people tell me that, and I've never been fired, thankfully. But I've definitely never been fired for a core value problem,
Yeah.
But unfortunately, we will fire you if you gossip. We'll give you a warning. You're human,
Yeah.
but we'll fire you for it. And I think, like, that was the thing, is, could we live and die by these, even when it's uncomfortable? Is this
Yeah.
good enough to make me want to come to work in the morning? Is this enough? Is this something that would be exciting enough for me to do this for 50 years? Because entrepreneurship's hard. This isn't always
Yeah.
fun, and healthcare is hard. People get mad at you and they yell and they're
Yeah.
mean. Um, but I don't know. Like, I think it started as that. I was part of a leadership group through Entre Leadership. It's a Dave
Mhm.
Ramsey kind of thing, and it's his business side. I don't have any folders full of cash in here, or envelopes, but yeah, I use that, and there's some really good tools through there to kind of help you with guiding. Hey, how do you come up with your why, and how do you? I think they did a really good job of breaking that down and making it easy. So I think we talked about that last time. That Entre
Yeah.
Leadership book was a good first step for me, and I ended up using their platform and working with a coach for about a year.
Yeah.
And I think that did help through that process. Maybe less so in the later stages of business, but definitely in the early process of what are we doing, why are we doing it, and how do we put the mission statement into words.
Wow, that's really incredible. And then I guess, just lastly, Kobe, I was gonna ask you, so you have your mission statement, you have your culture, you have your values. How do you get people to buy into that? Because I think that's one of the problems that, I'll just tell you, for any business, you have these values, you have this ideal, but to communicate that to your staff, to have your staff imbibe that and to feel that and to own it, how do you do that? How did you do that?
I feel like it's never done. I feel like it's getting to the point now that I've said the same little dumb thing so many times that my staff can repeat it. Like,
Hmm.
we do staff meetings every week, and during the staff meeting, we start with praises, right? So one of our core values is write thank you notes. We pass positives all around, we pass negatives up. That means it goes to somebody above you, not somebody beside you. That's lateral, that's gossip. And so we pass positives all around. So we start every meeting that way. And so it's like, hey, Zoe, you killed it over here. Bailey, way to go on thank you notes. Gina, dude, PAs and referrals are done so fast. Dr. Islam saw that patient the next day. You know what I mean? Like it. So we try to start with that, and then we try to tie back the praises to the core values quite often. So like, hey, man, our average wait time last week was 8 minutes. That's freaky fast, guys. You are killing it. Also, thank you for making me slow down and see that patient a little bit longer. I didn't know her dog just died, and
Hmm.
that's goofy and it's an example, but that stuff matters so much to the
Yeah.
patients. They don't remember the time that you lowered their A1C 5 points. They remember the time that you called them on their birthday. They
Yeah.
remember the little things that are above and beyond in that. And I think that's what my poor team has heard me say the same little goofy things so many times that they can start repeating it. So I feel like the more I'm the broken record of repeating the same thing, the better it's gotten.
So you do that every week. So every week you have kind of a meeting. So just kind of going just the tactics. So how often do you do, like, how long is the meeting? When do you do it? Who all is
Yeah.
there? 'Cause I think my audience, would really like to understand just an example of like how exactly practically do you do that?
So I do it probably incorrectly. I have my staff meet us at 7:30. I do offer it through Teams, but I really try to get people there in person.
Hmm.
And I do it in both locations, and I do it in person. So
Hmm.
if something comes up, occasionally we have to cancel and stuff, but I try to really prioritize it. I don't know if you've read the Death by Meetings book, but I don't want
Hmm.
to. I want it to be meaningful. And so sometimes if I feel like it's not meaningful, I'll cancel.
Yeah.
I do think you need to get in a structure, and they're going to be mad at getting there early or whatever. But you need to have structure, and I think the longer that we do that, the better it is. Ours only lasts 30 minutes. We have patients scheduled at 8. I just
Hmm.
moved it to 8:15 because I feel like it's like rushing out of there, and we have patients standing at the door. And
Yeah.
so a lot of people, I think it's worth the money investment to block time. I think eventually we will move to a point where we block 30 minutes of or 45 minutes or an hour of patients every single week, because I do believe that the communication is worth it. The team wants to know what's going on. They're excited. Like we got in a new supplement the other day, and so we're bringing on this thyroid supplement. They're excited about it. They want to know. And a lot of times it gets them buy-in of like, why
Yeah.
would you recommend that, Kobie? Or why are we painting the hallway this week? And it doesn't have to be all that important, but we praise the stuff we want to see. We try to recap really briefly of what we talked about at the last meeting. We bring up
Yeah.
anything that's new, and then we finish with opportunities for the staff to bring in concerns. And it's funny, the longer we do it, the more the staff buys in and participates. And they're like, hey, yeah, we need to do this. This is broken. What system can we come up with? Or this is broken. I feel like this is the solution. What do you guys think? And so the staff really has some ownership in it. And I think, again, you have to praise that because that's one of our core values, the ownership mentality. And so you have to praise what you want to see, but it can be good. And I've sat through some really bad meetings, and I've probably led some really bad meetings, but I hope it's getting better.
That's great. Perfect. Well, Kobe, I want to appreciate, number one, I want to thank you for your time. I know it's late. I know we went long, but I want to thank you for your time. I think your clinic and you as a business person, as a provider, is an inspiration to me, to my patients, to my audience. This is a fantastic conversation. Where can people hear more about you, your practice? If they want to come see you, for example, as a
Yeah.
patient, where can they get more information about you?
Absolutely. So soon it will be txcare.com. But right now it's Snyder Family Healthcare. We're on Facebook, we're on Instagram, we're on TikTok, we're all over the place. in Sweetwater Family Clinic, and both of those have their own websites. But yeah, I'm in Snyder a few days a week. I'm in Sweetwater on like Wednesdays and Fridays. We're taking new patients in both places, and we're real big on getting people in same day. So if you call today, either location, if you don't get an appointment, email me because you should get an appointment today if you want one.
Awesome. No, it's fantastic. And pretty much you take care of all ages except for obviously not pregnancy, which we talked about before, but
Yeah.
all ages, all
Yes.
types.
So one thing that we're not really doing yet, and it's a me problem, it's not a desire problem, is we're not doing a lot of childhood vaccines like under 4.
Hmm.
And a lot of that is because we don't participate in health steps, and so we don't
Hmm.
have the state funded vaccines.
Hmm.
And the other thing is I don't know that our pediatric population is big enough yet to support the vaccines. They're
Yeah.
crazy expensive for private pay, or private insurance vaccines. And so I feel like a lot of times we will see you if you're sick, but a lot of times if you're under 4, I'm like, hey, see a pediatrician. Let's make sure we're hitting those standard steps. After 4 or so, come see us if you want. But there's definitely a lack of pediatric care in our part of the world and most of rural Texas. So I hope that we can address that soon. But I'm not that great at it. We hadn't found that right person for it yet. So maybe next year when we talk, we'll be talking about our pediatric program.
Yeah, perfect. But anything beyond that though, you guys accept, you guys take, and you guys see.
Absolutely. We love it. And I think it breaks the monotony, man. You might go see somebody for Botox 1 minute and then walk into strep throat. And then you might walk in and talk to somebody about why they should talk about hormones because they don't like their spouse anymore. So it's fun, man. It's sweet. I know I didn't talk about it much, but man, hormones are so fun because people come in and they're like sitting in different chairs in different side of the room, and then they walk back in and they're like holding hands a month later, and you're like, yes.
Let's talk, Kobe, if you have time, I have time. If you want to talk about it, let's talk about it.
Yeah. So
Yeah, so talk. So I see hormones everywhere.
yeah,
Tell us about exactly what is going on and how
yeah.
hormones can help out patients. What patients would need hormones? Absolutely, we'd love to talk about that.
Ah, man, I feel like as far as what patients need hormones, I can't pick them out anymore. I joke and tell people we have a menopause epidemic or something going on. Like, okay, me personally, I tried to blame Dr. Britton. He told me it wasn't his fault, but I never checked my hormones.
Mhm.
I was 24 or 25 when I got a vasectomy, and then I checked it
Mhm.
afterwards because I was like, cool, we're done having babies. Let's talk about testosterone. And it was
Mhm.
crazy low. It was like 214. Checked
Mhm.
again in the morning, 214. Now, knowing what I know, I really should have addressed, my crazy cortisol levels and my bad carb and sugar intake, and some of the lifestyle stuff that I was contributing to that.
Yeah.
But I do know that once I got on hormone replacement, man, I felt a lot better. Everybody comes to me that's men. Well, let's say everybody. Men, when they come to me, they're like, "Oh yeah, man, I want to get jacked in the gym," and everybody assumes that you get on testosterone and your 16-year-old body comes back, and I wish that it was that way. It's really not. What most people come back and tell me, as far as men go, is that 5 o'clock feeling is better when they get home. They don't just crash out in a chair and fall asleep on the couch. They have more energy to work on projects. They're better dads. They're better husbands. Um, sure, libido may happen. Hopefully, you burn some visceral fat and put on some muscle mass and you have some better results, but it's only a tool. It's not going to fix itself. If you're working out and you're putting in the effort, yeah, it might work. The people that are just doing it and not much else, that's where you see a lot of that motivation, better sleep quality, less inflammation, maybe less joint pain, but that 5 o'clock motivation seems to be the first thing people
Mhm.
talk about.
So how would a patient know if they are having issues with hormones? Like what would be kind of the signs that someone would, as a patient, like, hey, I'm, this may be a sign of a hormone or testosterone deficiency.
Yeah, with testosterone, male and female deficiency, I want to be really cautious in talking about that because I do feel like there's a lot of androgen deficiency even in females.
Hmm.
I think the number one symptom across the board that people complain of is fatigue.
Yeah.
Um, and as you know, fatigue is such a difficult diagnosis, man. It could be a nutrient problem, it could be a A1C problem, it could be a hormone problem. It might be that we need to address sleep apnea or obesity. There's a million things it could be. So I really think that initial encounter matters to me. I feel like with sleep apnea, I see people that are, well, their spouse complains, first of all. Maybe you see that erythrocytosis, that elevation of red blood cells on their labs. But a lot of those people are that early morning fatigue, first thing in the morning,
Yeah.
right? I wake up tired even when I sleep well. I sleep 9 hours and I'm still tired. I
Yeah.
feel like fatigue as a hormone deficiency a lot of times is the motivation. Hey, I used to have all this motivation, and now I can't even stay awake at 5 o'clock. When I get home, I'm done.
Mm.
I'm irritable, or whatever that looks like. So I think fatigue is across the board the number one symptom that I hear of. Um, but yeah, that I think the biggest improvement that comes back afterwards is also fatigue. So that's pretty cool. That doesn't
So
mean
one of the
everybody needs.
questions I have about one of the questions I have, because I thought about this. There's so many people that are on hormones right now, but how can it possibly be that everyone is deficient? That's the dilemma I'm trying to figure out in my head, because
How many people do you think are in excess to cortisol?
I don't know. I have no idea. I
I
really
bet
have
it's
no idea.
we love it, right? As Americans, we want to prioritize and praise these people that work too many jobs, and we
Yeah,
stare at a blue light on our phone or TVs all the time. We don't sleep well. We eat like junk.
yeah,
Our foods are processed, and we so the response to that, I think the overwhelming problem with America, well, maybe the world, but definitely America and our population is this cortisol response, this
yeah,
stress response, right? If you were to condense all the things into one and you could only fix one thing, I think it's that. We're stressing our bodies out. And what happens with cortisol response, well, everything happens with cortisol, right? But what happens with sex hormones is it suppresses your body's production of stress hormones or like crazy. So
yeah,
I think that yes, there's an epidemic of, probably epidemic, that's a bad word. I think there is a lot of people that are struggling with hormone deficiency that may or may not have ever been tested. But I think that the underlying problem, going back to that holistic care, is probably self-inflicted to a lot of extent, and myself included. Like I said,
yeah,
whenever I started my role, I know now, had I worked on that, I wonder what my level would have been even 3 to 6 months out. Because I've seen
yeah,
people that are like, yeah, no, I still want to have babies, and all that stuff. And I'm like, well, I don't want to suppress anything by giving you exogenous testosterone. So
yeah,
I've seen that rise happen. I've never seen it with taking the junk from the TV ads or anything like that. I've never seen a bunch of results from anything over the counter, unfortunately, on serum testosterone levels. However, I have seen an improvement by controlling, what's going on with the glycemic control and what's going on
yeah,
with my glucose and my stress and how am I sleeping and what am I doing for myself.
yeah.
I've seen improvement there. So just my opinion. And there's not a big body of evidence probably that I could pull up to prove that right now. But Kobie theory.
No, that makes sense. So what would be kind of the main, I guess, side effects or things you watch out for people who are on hormone replacement therapy? What are things that they need to be aware of,
Yeah,
or concerns as a provider that you want to make sure that if this is the right person or not, or things that you look for follow up for these patients?
I screen. Okay, so if you go to a lot of your bioidentical hormone training, they will all tell you like, oh, all of the studies with problems were with synthetic testosterone or estradiol or estrogen, not beta 17 estradiol. The truth is, do we know? I don't know that we know. They have pretty good, compelling arguments. I've been through BioT training, of Exius training, some of those really great programs, and they have amazing training. I send my staff to it,
Mhm.
but I don't know, and I'm not. I don't think any of us really do, and so I'm way overkill on some of our screening and prevention. So I talk to people about the possible risk. I tell them that I don't know. I tell them like, hey, look, if you get on testosterone, I'm not sure if you are already geared towards prostate cancer. This is sometimes like pouring gas on that, whether it's synthetic testosterone cypionate or bioidentical testosterone. Obviously that's only the men that get that conversation, but
Yeah,
I just tell them I don't know. And so I usually do a baseline. I don't care if you're 30 and you're getting on testosterone. I do a baseline PSA. I check it every 6 months for a while just to make sure there's no climb there. And I do a free and total PSA. And I tell them, you may get an insurance bill for this because insurance probably only wants me checking this once a year. And that's
yeah,
probably after you're like 45. So
yeah,
I just tell them this is a part of doing hormones with me.
yeah,
Same thing with the ladies. I overtest, as far as breast cancer goes. I annoy the snot out of them. I have patients that don't see me for primary care. They just see me for hormones. And,
yeah,
whether it's pellets or creams or I don't start a lot of synthetic estrogen, to be honest with you, but if whether I'm doing hormones for them in that aspect or not, and they get annoyed with me because I'm like, hey, where's your mammogram? Can I order you one? Where do you want to go? Because I want to say that we don't know, and so if
yeah,
you are predisposed to breast cancer, even if you're not a BRCA carrier or something like that, we still really need to be on prevention, whether we're talking about something covered by insurance or not. We need to, as the provider, we have to geared people towards safety. So
You're exactly right. So would you treat somebody then? Do you typically just, assess their symptoms, and then do you typically kind of check their levels and see where they're at? And then if their levels are low, then
mhm.
you suggest treatment. Is that kind of how it works?
Absolutely. And I think no matter what, whether you're coming in for a weight loss consult or a hormone consult, or you just want to establish care, that's pretty much how I practice. I can't say across the board everybody that works for me practices the same. We have autonomy, but yeah, as far as how I practice, I definitely think no matter what you're establishing care for, I like to get baseline labs for the preventative side, but also you very rarely meet people that are like, yeah, I have the same energy I did 5 years ago. Cool. Let's talk about it. Let's see if there's a problem. If not, let's talk about your diet. Let's see what's going on. So.
Yeah. Now, do you for the hormones specifically, do you treat patients, let's say that their numbers are relatively normal for, let's say, testosterone, for example, but they feel tired, they have that 5 o'clock drain. Do you how do you kind of deal with that? Do you still treat them like that, or do you try to do more other lifestyle changes, or what does that kind of scenario look like?
I think it depends on the person.
Hmm.
I do have a lot of patients that are, if you, okay, let's say that you're a 40-year-old male and you come in today and you are fatigued and I don't want to say erectile dysfunction, that's extreme, but you know what I
Yeah.
mean, fatigue, decreased libido, 5 o'clock, you're just feeling drained, and we get your labs back and they're 400. So
Hmm.
normal range for that age, I think if I remember right on our lab, is 300 to right under 1,000.
Yeah.
Okay, so you're in the normal range. If we can't come up with another solution, right? Like if you're pretty active and you're going to the gym and you do not have sleep apnea, and we're trying to work on diet and it doesn't matter, I will start those patients on it. I just tell them, look, this is not hypogonadism. However, when
Yeah.
we replace this, your body is going to suppress its own endogenous. This is going to lower your sperm count. This could increase your risk of prostate cancer. I don't know. I think just having that conversation with them and being really honest
Yeah.
is reasonable, right? These patients don't want the answer to be no. I think that's the problem with people that come in with a sore throat. They want something, like and so I feel like the answer is not always antibiotics. It's not strep, but
Yeah.
what can we offer you? How can I help you? And so
Yeah.
I think there's a time to tell people no.
Yeah.
I think there's
Okay.
also
Yeah.
a time to follow guidelines. And I also think that some people that have a 302 testosterone and it's not less than 300 probably should be on testosterone therapy.
Yeah, I know that one little two, it makes the
Yeah.
biggest difference between being hypotestosterone and being normal. Yes, that makes complete sense.
I was about to say, don't get me started on your A1C of 6.4 and you can't get Ozempic, but
I know. That's true. Well, perfect.
but no,
Okay.
I do think free testosterone, though, if you're looking at total testosterone, I do feel like free testosterone correlates more to control of symptoms with treatment, male
Yeah.
and female, and also symptoms of low T. So I do
Yeah.
a free and total, and I do a sex hormone binding globulin when I draw labs.
Yeah.
I think again, Kobie theory, but I feel like it gives you a better picture.
Yeah. No, that's great. Well, Kobie, I want to thank you for your time. Man, I appreciate it. So,
Yeah.
if you guys enjoyed this, I would encourage you to visit their website. We'll put the information in the show notes down below. He's a great provider. He's a great friend. I think you've seen, just based on talking to him, what type of patients, but what type of practice he has. And for me, knowing Kobie and knowing the type of practice he has, I absolutely would send my friends, my patients, my family to someone like him. And so, if you want to be treated like someone who's taking care of your family, I would highly recommend you make an appointment to see Kobie and to see him both in Snyder and Sweetwater. Once again, we'll put the show notes down below. But thanks for joining us today, Kobie. Appreciate
Hey,
it.
man, thank you so much. I had a blast. Oh, I gotta say, my kids were stoked for me to be talking about poop. So they were so excited. I have a 4 and a 7-year-old. They were like, "Oh, Dad's gonna be talking about poop tonight. He's not gonna be at bedtime." I was like, "Yes."
Oh, it's awesome. That's great. Well, perfect. All right, everyone, thank you for listening to my podcast. If you like what you hear, if you like what you see, consider subscribing to my YouTube page, my Facebook page, my TikTok, and more importantly, if you're having GI issues, come see us at Lubbock Gastro so we can find out what is going on. Our job is to get down to the root cause of why you're having the issues. If you're frustrated by your health, if you're frustrated about what's going on, come see us so we can get down and get you feeling better. Thank you for listening to us. I look forward to hearing you guys on future podcasts.